Hi, Dr. Mehta, wishing you a very happy and incredible anniversary. I hope this day brings more happiness and more love to you. May each day hold beautiful experiences for you. I hope and pray that you succeed at everything that you do. Sending you and your loved ones all of my love. Take care.
Hi, Dr. Megh Mehta. I hope you and your loved ones are staying safe. Actually, I'm here with a wish just for you. I wish and pray that happiness and success follows you all through your life. May you achieve all of the good desires of your heart. All my love and thoughts are with you. And hello to your whole family and friends. Lots of love to everyone. Take care and be safe.
Hi, Dr. Megh Mehta. This is Vidya Balan, and I'm reaching out to say a big congratulations. Please know that we both are constantly rooting for you and are very proud of your achievement. We both wish you continued success in all that you do. Just aim high and onwards and upwards. You deserve the best.
Hi, Dr. Mehta. This is Arjun Kapoor, and I'm reaching out to say congratulations. Embrace your win, own your success, and bask in the glory. You deserve it. Your loved ones and I are so happy that your hard work and determination paid off. Kudos. Keep moving onward and upward.
Hi, Dr. Megh Mehta. I'm sending you my love and my best wishes. Thank you so much for your support. It means the world to me. Have a wonderful year. Good luck for your future and just be happy always. Take care. Bye.
છે તમારી ફેવરિટ આઈસ્ક્રીમ પર 50% ઓછી કેવિટીઝની ટેમ્પટિંગ ઓફર, પણ આ ઓફર માત્ર રાત્રે બ્રશ કરવાવાળા માટે જ. કેવિટીઝની શક્યતા 50% સુધી ઓછી કરો. સૂતા પહેલા બ્રશ કરો.
And when not treated, this can have serious consequences for your oral health. Cracks can come from injury or large fillings that weaken the rest of the tooth. Even small cracks can allow bacteria into the tooth, causing decay or infection, leading to further destruction. A cracked tooth may or may not be sensitive to hot and cold or be painful when biting or chewing. Cracks that progress too far can result in entire sections of the tooth breaking off, and in some cases, loss of the tooth. For many reasons, sometimes people aren't able to maintain the recommended frequency of dental checkups. Oftentimes, when an extended time has gone in between cleanings, a more advanced cleaning may be recommended by your doctor. Harmful bacteria and hard tartar deposits called calculus build up on your teeth above and below the gum line, releasing toxins that cause gum disease, also known as periodontitis. Unfortunately, this buildup occurs in areas that can't be taken care of by brushing, flossing, or even a regular dental cleaning. Over time, as periodontitis progresses, it can lead to increased inflammation, bleeding, receding gums, and ultimately receding bone tissue. Your doctor can recommend a procedure called scaling and root planing to remove these deposits from your teeth. Scaling and root planing is a specialized procedure that removes excessive calculus and bacterial deposits beneath the gum line and is usually performed with a hand scaler and an ultrasonic cleaner, which uses high-frequency vibration to separate the calculus from the tooth. This procedure is for advanced periodontitis cases, and in many cases is so extensive that it must be done in stages. It may require multiple appointments to complete in order to ensure you are as comfortable as possible during the procedure. By removing the deposits and bacteria, this procedure is in many cases able to halt the spread of periodontitis. Your doctor will help you determine the next steps for continued rehabilitation of your gum tissue. However, if these symptoms are not treated appropriately, the progression can advance to a point of tooth and bone loss requiring costly and painful reconstructive dentistry to treat. Tooth wear is a dental condition where the surface and structure of teeth are progressively reduced as a result of internal and/or external forces placed upon them. When hard tooth material is worn away as a result of teeth grinding and/or clenching, it is called attrition. The extent of wear damage depends on the amount of grinding and is typically more severe in individuals who exhibit this behavior in their sleep. The reduction of hard tooth material due to chemical forces is called erosion. It can be caused by drinking acidic beverages like soda or by medical conditions like acid reflux or bulimia. Over time, this acid dissolves the outer enamel of the teeth and can expose the softer underlying dentin layer. Wear caused by an outside object is called abrasion. Abrasion can be caused by improper toothbrushing technique, excessive use of toothpicks, and the use of the teeth as a tool. It can result in grooves and notches in the enamel that can also expose the dentin. Excessive tooth wear causes many oral health complications, including unattractive and irregular tooth levels, jagged and sharp tooth edges, tooth pain, and eventual loss of the teeth altogether. As the harder outer surface of the tooth is worn away, the softer dentin will be exposed, speeding up the process. There are preventative and corrective treatment options for patients experiencing tooth wear issues. Treatment will vary based on the cause of wear and when it is detected, making it critical to work closely with your doctor to proactively treat the issue before more damage is sustained.
out loud. When people stare at my skin, I smile out loud. When people stare at my teeth, I smile out loud. An all-new teeth whitening revolution is here. Visible White O2, supercharged with millions of oxygen bubbles to whiten teeth in just 3 days. Colgate Visible White O2.
An abscess is a pocket of pus that forms at the root of the tooth due to a bacterial infection. If left untreated, the abscess can possibly spread to other areas, causing severe consequences to your overall health. The infection usually originates from the inner pulp of the tooth and can be caused by tooth decay and dental trauma. As the infection spreads, your body forms a sac around it to attempt to contain it, which creates pressure and painful sensations. Signs and symptoms that you have an abscess can include a consistent throbbing toothache, fever, swelling of the face, gums, or jaw, foul-smelling breath, and pain while chewing. You may also experience a foul taste in your mouth if the abscess is draining pus. An abscess will not heal on its own, and if left untreated, the infection can spread to the jawbone and other parts of the head and neck. If allowed to expand, it can also weaken the jaw as it begins to resorb and replace bony tissue. Abscesses are very serious, so it is critical to work closely with your doctor to treat it as early as possible to minimize the potential for harm. Gingivitis is an inflammatory condition of the gum tissue caused by the buildup of bacteria on the teeth. It is an early form of gum disease that has not progressed to the point of tissue or bone loss. When plaque is allowed to remain on the teeth, the bacteria within it begins to cause redness, irritation, and swelling of the gum tissue. Since gingivitis rarely causes pain, most patients do not even know when they have it. Additional symptoms can also include sensitivity and tenderness of the gum tissue and slight bleeding when brushing, flossing, or probing during an examination. You may notice your toothbrush or floss having a slight pinkish tone to them after use. If left untreated, gingivitis will progress and further complications can arise. It is important to consult with your dentist on the best course of action to halt the disease progression. When a tooth's structure is compromised, the crown rebuilds the tooth to optimal shape and function. A crown can be metal, ceramic, or ceramic covering metal. It typically requires multiple appointments to complete the process of getting a crown. At the first appointment, your doctor will take an impression or mold to help make a temporary crown for your tooth. Next, the tooth is prepared to make room for the crown. Your doctor will take another impression of the prepared tooth and put in a temporary crown while your final restoration is being expertly constructed by a dental laboratory. At a subsequent appointment, your doctor will remove the temporary crown and replace it with the final restoration. Once completed, your tooth is now restored to ideal shape and function.
Disease that attacks the supporting tissues of the tooth. Its attack is at the bone level, and the damage involved is irreversible. This problem is the result of the accumulation of certain bacteria that release destructive toxins. Tartar carries microorganisms. Periodontics aims to eliminate all rough spots that impede the attachment of the gum to the root of the tooth. The difference is that this one is done under local anesthesia so as to avoid any pain during the sampling of deposits lodged more deeply. Periodontal flap surgery is a technique often used following the failure of a less aggressive approach or when access to the rough spots become difficult because the tartar is located too deeply. Moreover, the lack of visibility adds the difficulty of removing all deposits, thus impaling the healing of the tissues. Periodontal flap surgery consists of shifting the gum to allow a good view of and direct access to the surface to be smoothed down. Bone remodeling can also be done in order to recover the natural anatomy, thus enabling easier brushing and flossing. Once the root has been freed of its imperfection, the gum is replaced and held in place with stitches or glue. Take note that certain surgeries can bring about the exposure of part of the root, which might lead to sensitivity to cold or hot food. After
video, we'll show you the best way not only to brush your own teeth, but also how to easily brush the teeth of others. Toothbrushing should be carried out twice a day, in the morning and last thing at night. We must remember that not everyone can brush their own teeth. But when brushing other people's teeth, the principles are the same. Please remember that toothbrushing takes a full 2 minutes. Yes, 2 minutes. Use a small-headed, medium-texture bristles toothbrush with a small amount of fluoride toothpaste. Start by tilting the toothbrush against your teeth so the bristles are at a 45-degree angle to the gum line. Move the brush in small circular movements, a few times on each tooth. Next, brush the outer surfaces of each tooth, keeping the bristles angled against the gum line. Do the same thing for the inside surfaces of all the teeth. Now, brush the biting surfaces of the teeth, on the top and the bottom. To clean the inside surface of the front teeth, tilt the brush vertically for the upper teeth. Gently move the brush long ways down the tooth from the gum for a few seconds. For the lower teeth, tilt the brush vertically and pull the toothbrush gently upwards from the gum for a few seconds. If plaque is not removed from the teeth, it leads to bleeding gums and tooth loss. If you eat or drink sweet things, plaque mixes with the sugar and causes tooth decay. Finally, spit out any remaining toothpaste. Do not rinse the mouth with water or any kind of mouthwash. In this way, the fluoride in the toothpaste will help protect the teeth.
For many reasons, sometimes people aren't able to maintain the recommended frequency of dental checkups. Oftentimes, when an extended time has gone in between cleanings, a more advanced cleaning may be recommended by your doctor. Harmful bacteria and hard tartar deposits called calculus build up on your teeth above and below the gum line, releasing toxins that cause gum disease, also known as periodontitis. Unfortunately, this buildup occurs in areas that can't be taken care of by brushing, flossing, or even a regular dental cleaning. Over time, as periodontitis progresses, it can lead to increased inflammation, bleeding, receding gums, and ultimately receding bone tissue. Your doctor can recommend a procedure called scaling and root planing to remove these deposits from your teeth. Scaling and root planing is a specialized procedure that removes excessive calculus and bacterial deposits beneath the gum line and is usually performed with a hand scaler and an ultrasonic cleaner, which uses high-frequency vibration to separate the calculus from the tooth. This procedure is for advanced periodontitis cases, and in many cases is so extensive that it must be done in stages. It may require multiple appointments to complete in order to ensure you are as comfortable as possible during the procedure. By removing the deposits and bacteria, this procedure is in many cases able to halt the spread of periodontitis. Your doctor will help you determine the next steps for continued rehabilitation of your gum tissue. However, if these symptoms are not treated appropriately, the progression can advance to a point of tooth and bone loss requiring costly and painful reconstructive. For many reasons, sometimes people aren't able to maintain the recommended frequency of dental checkups. Oftentimes, when an extended time has gone in between cleanings, a more advanced cleaning may be recommended by your doctor. Harmful bacteria and hard tartar deposits called calculus build up on your teeth above and below the gum line, releasing toxins that cause gum disease, also known as periodontitis. Unfortunately, this buildup occurs in areas that can't be taken care of by brushing, flossing, or even a regular dental cleaning. Over time, as periodontitis progresses, it can lead to increased inflammation, bleeding, receding gums, and ultimately receding bone tissue. Your doctor can recommend a procedure called scaling and root planing to remove these deposits from your teeth. Scaling and root planing is a specialized procedure that removes excessive calculus and bacterial deposits beneath the gum line and is usually performed with a hand scaler and an ultrasonic cleaner, which uses high-frequency vibration to separate the calculus from the tooth. This procedure is for advanced periodontitis cases, and in many cases is so extensive that it must be done in stages. It may require multiple appointments to complete in order to ensure you are as comfortable as possible during the procedure. By removing the deposits and bacteria, this procedure is in many cases able to halt the spread of periodontitis. Your doctor will help you determine the next steps for continued rehabilitation of your gum tissue. However, if these symptoms are not treated appropriately, the progression can advance to a point of tooth and bone loss requiring costly and painful reconstructive.
This animation shows two identical situations being treated in two different ways. The loss of the central incisor. The animation on the right shows the implant option. Here we have an immediate implant placement followed by the post and core, which is secured to the implant fixture, followed by a crown. In this situation, we do not involve the adjacent teeth. On the left, we have the bridge option. Here we must cut down the adjacent teeth. There is significant tooth reduction, and the teeth may become sensitive or even need root canal treatment at this early stage of the process. A bridge, which is basically two crowns with a tooth in the middle, is cemented on top of these prepared teeth. Comparing the two situations at the early stages of post-treatment shows that they can have similar cosmetic results. However, with the passage of time, there may be bone atrophy in the area of the missing tooth, which often leads to recession around the adjacent teeth. Depending on the margin integrity, cavities may start to form around and under the crowns. They're difficult to diagnose, and if left undetected, can grow to levels where the cavity reaches the pulp. This in turn may cause root canal problems as well as pathology at the tip of the root. With continued destruction of the tooth will have fractures, mobility, and often associated infections. Comparing the two options again highlights the advantage of not encroaching on the adjacent teeth. The infections can create unsightly pus that drains into the mouth, creating a metallic taste and bad breath. Below the gums, we have bone destruction. The only solution at this time is to remove the bridge and the destroyed tooth as well. To continue with the bridge option, we again need to cut down another tooth and make the bridge bigger. A 4-unit bridge can then be placed on the 2 prepared teeth. This bridge will not look as good as the original due to the bone loss. The process of atrophy will continue as before. Comparing the two results now clearly shows the destructive possibility of the bridge with time. Since the number of teeth to support has doubled, there is now even more of a chance to have the same consequences happen to the next tooth. The bridge will once again have to be removed and more teeth prepared to hold the now 6-unit bridge. Comparing the two options, we can see that the implant replacement of a tooth is less traumatic and less expensive in the long term.
Colgate's Optic White Pen is a hassle-free way to whiten your teeth. Here's how to use it. On your first application, click the pen up to 20 times for the first drop to appear. On each additional application, you will only need to click the pen once or twice, which will provide enough serum for up to 4 teeth. For best results, dry your teeth with a tissue, then apply a single thin layer onto each tooth across the row. Re-click the pen once or twice after every 4 teeth and continue to apply. Wait 10 to 15 seconds for a clear coating to form. Repeat with the bottom row of teeth. Leave the dried coating on your teeth overnight. The serum will form a coating that continues to whiten as you sleep. In the morning, brush your teeth like normal to brush away the coating and reveal a brighter, whiter smile. To clean your pen, wipe the brush bristles with a dry tissue. To keep the pen from drying out, clean the bristles using a dry tissue only. Make sure not to use water. Then firmly close the cap until you hear a click. If the pen dries out, click 2 or 3 times to dispense more serum and flex the brush to soften. And that's how to use Colgate's Optic White Pen for a whiter, brighter smile.